Today on Power Supply, we will be speaking with Juan Gonzalez, VP of Engineering, Quality, and Regulatory Affairs, and we'll have Dr. Sarah Simmons, Science Director at Xenex, back with us for the second episode in a series of 3 that are the only CEC-approved podcasts on UV for supply chain professionals. We're going to be talking about a clearer path to UV decision making and really simplifying a lot of this UV decision making. Now, Juan Gonzalez, as the VP of Engineering, Quality, and Regulatory Affairs, has a very broad view, and specifically around something that we talked in the first episode about, which is FDA authorization and regulation. So he's going to go a lot deeper into that conversation. And then Sarah's going to talk to us about risk avoidance, cost avoidance, and some additional important considerations for sourcing. So definitely stay with us. We're going to be right back after a short break. Joining me now is Dr. Sarah Simmons, Science Director, and Juan Gonzalez, Vice President of Engineering, Quality, and Regulatory Affairs at Xenex. And Sarah, this is your second episode, so you've been with us before. Juan will introduce you in a second, but Sarah, for anybody that's catching the episodes out of order, and this is the first one they're listening to, can you just remind everybody your role at Xenex and talk about your career a little bit?
Absolutely. So I'm Dr. Sarah Simmons. I'm the senior scientist here at Xenex. I am an epidemiologist and biostatistician. And the work I do here at Xenex is in R&D for our devices and in clinical consulting for our sales team when hospitals are implementing our product. My professional background is in infection prevention and control, specializing in critical care.
And Juan, it sounds like you wear several hats at Xenex. So if you could just talk about your background and introduce yourself to the audience as well, that'd be great.
Absolutely. Thank you very much, Justin. Firstly, it's a pleasure to be here with everybody. We're looking forward to this conversation. And as you mentioned, yes, my title is VP of Engineering, Quality, and Regulatory Affairs. So what that really means is taking care of product development all the way from the beginning, all the way through introduction into the marketplace, meeting the necessary regulatory requirements, and making sure we meet the necessary quality requirements as well. And I've been at Xenex doing that for about 6 years now, so across multiple models of the robots that we put out into the marketplace. So really, it's a product development from the time the product is conceptualized through the time it's born into the market until we sunset it at end of life. My background has been primarily in product development, and most of my career spent in medical device product development. You name the different types of medical devices, probably have been involved in one way or another throughout my career, and happy to be able to be doing it here with Xenex.
Well, that's great, Juan. Thanks for that. And it's so interesting that you really see the full life cycle of the device. I think that's gives you a unique perspective today. And I do want to remind everybody who's listening, this is the second episode, but the entire series is the first and only continuing education credit approved podcast on UV for supply chain professionals. And so we're pretty excited about that. And if you didn't listen to the first episode, I want to just point everybody in that direction. Make sure that you listen to all of them. So I think today we're going to start talking about the regulatory landscape. And so, Juan, I think it's a big part of your role. So you're going to be able to kind of walk us through this a little bit. But things have changed, as we learned in the first episode. So what is the regulatory landscape for UV robots that are being used in healthcare environments?
Yeah, thanks for leading into that, Justin. This is extremely important for us as an organization and extremely important for this marketplace as a whole. In years past, the regulation wasn't clearly understood. It required conversations with the EPA and FDA over several years to determine exactly where did this product fit. Since we really didn't fit neatly under the description of what a medical device is. For many years, we were regulated via EPA as the pesticide device. So we registered with EPA and we provided the necessary data to them year over year of how many products we sold, but the regulation was pretty lax. So what happened during the pandemic is many companies came into this space, from the small little simple devices to full-fledged robots like the ones that we deploy at hospitals around the world, actually. So safety and efficacy was something that came to the forefront with many individuals and many of our customers. They wanted to know, is what I'm buying something that's safe and something that's actually doing what the label says? During that time, we opened up conversations with FDA to establish what do the intended use and the indications for use need to be for a product like this, so that we can start to make sure that we set what that bar needs to be that everybody needs to meet. So we started that work during the pandemic with FDA and continued it all the way to the point where we established the category for whole room microbial reduction in September of 2023 via the granting of the de novo for the LightStrike Plus. So what does that mean? Well, for starters, we needed to make sure that we understood what were the general controls that needed to be met for this type of medical device. We needed to clearly understand what makes it a medical device. And what it came down to is the following. We were reducing the microbial load of the surfaces of other medical devices. That is what made us a medical device, and what makes any product that's being used to reduce the pathogen load within an environment in the presence of other medical devices, that makes it fit under that category. So that was step number one. What is the intended use and what are the indications for use for a product like that? So what came after that is, okay, well then how do we make sure that we provide the necessary data to show that we meet the general controls? And then we also had to propose what the special controls needed to be, because a category didn't exist where whole room microbial reduction fit neatly under. So it was over a period of a couple of years working back and forth with FDA so that we can come to an agreement of what that needed to be. And then we worked on our submission and put that in, and eventually were granted the de novo in September of 23. So for a period of time there, we were the only UV robot being used in healthcare that was actually authorized as a medical device. What did we have to prove? Well, number one, safety. Is this product safe to use in that environment? And there are several standards that needed to be met, most commonly the 60601 electrical safety standard for medical devices, which we obviously met. There were cybersecurity requirements that had to be met, software requirements that had to be met, and all those had to be done in such a way that we met the requirements that FDA lays out for medical devices in general. But then the other side of it, the efficacy. How do we prove that we're actually doing what our label says? And that required us, and it was a great amount of work from Dr. Simmons and her team, to be able to establish what are those tests that we need to do to show that we're actually meeting those claims that we're making on our label. So over a period of many, many months, working very closely with FDA to review these protocols to say, yes, this is what's needed in order for us to prove that this is actually an efficacious device. It required bench testing with a series of different organisms. It required simulated use testing. But then it also required actually in-hospital testing to show that from a usability perspective, it can actually be used and reach the levels that are expected. So all of that was collected and made part of our submission. Our hope is that the rest of the marketplace would fall into place very quickly afterwards. But that really wasn't the case. As mentioned earlier, during the pandemic, there were a lot of small shops that brought products to the table. But we used the phrase saying that they really didn't have the stomach to be able to go through these regulatory hurdles. And we saw many of these competitors basically close up shop and go away. But we knew that there were several other of our peers in this marketplace that do have the infrastructure to be able to do it. And slowly but surely, more of them were trying to do this. And eventually, one of our competitors was able to get K clearance for their device for whole room microbial reduction using our LightStrike Plus as the predicate device. The phrase I like to use is, we set the bar and other competition needs to make sure that they're able to clear that bar in order for them to get their 510K or their 510K clearance to introduce their product into the marketplace. That also means, though, is that there are still several devices out there that do not meet the regulation. And based on the Code of Federal Regulations, I mean, they are considered adulterated and misbranded devices. And eventually, they'll have to come in under the regulation or otherwise face potential regulatory issues with FDA.
I really do feel like it was the Wild West, just as you described, and there was an explosion around the pandemic because I think a lot of hospitals were just not sure how to address this challenge. And as a result of that, I think it placed a lot of burden on the supply chain. And if you remember, they were trying to find ventilators and, this was just another thing to evaluate, but there was really no criteria to evaluate quality. And so I think what changes were made here in setting a bar and, working with the FDA, I think was a really important step into sort of not only helping hospitals with their sourcing initiatives, but also to set a quality standard and to prove that you can deliver on that quality, as you said. And we're going to talk a little bit more about considerations for sourcing and dive a little bit deeper later in the podcast. But I want to talk about a couple of areas that I think are important as well, which is exactly how does UV support risk avoidance? Because that's really what we were trying to do when this explosion happened in the pandemic, was how do we manage risk? There's a great deal of risk here to our patients and our employees. And then how do we does it also support cost avoidance, and not necessarily the cost considerations around sourcing, but the inherent costs from infection and transmission, right? And so, Sarah, I think maybe you can lead this part of the conversation, and Juan, feel free to jump in anywhere along the way and add details as well. But let's start with risk avoidance, Sarah. If you can kind of talk about how UV is really addressing that.
Happy to. I get to be a little infection control nerd now, and I'm so excited. So the reason we want to introduce UV devices into the healthcare environment is because the manual cleaning that our environmental services staff are doing is not perfect, and we can't expect it to be perfect. The things that are causing risk within the environment are invisible to us. Our EVS staff can see, the dust on the floor. They can see the orange juice on the overbed table. They can't see the MRSA on the bed rail. They can't see the C. difficile on the sink handle. And so when they're cleaning, those organisms can sometimes get left behind. And then UV comes in as an adjunct technology, never as a replacement, to get rid of those organisms that are left behind that can potentially pose a risk to the next patient in that room. There was a really excellent set of studies that have been done over the last probably 15 years called prior room occupancy risk studies. And these are studies where we take two different patient rooms. One previously housed an infected patient with, let's say, Klebsiella or Pseudomonas or Staph aureus, and the other room had a patient who was not known to be infected or colonized. We discharge these patients, we clean the rooms, we admit new patients, and we follow those new patients for infection. And what these studies found is that patients who are coming into a room that was known to house an infected patient before are at much higher risk for developing infection with the exact same bacteria. And we know this enhanced risk is coming from the environment because that's the only thing those patients have shared is the room that they are in. And this risk varies from organism to organism. For our gram-positives, like MRSA and VRE, that risk is around 40% increase. For our spore formers, like C. difficile, it's about 130 to 150% increase. But for our gram negatives, these really scary drug-resistant bugs, it can be a 200 to 300% increased risk of infection if you're admitted to one of those rooms. So again, the purpose of UV is to take that transmission risk associated from environmental contamination and bring that bioburden down and reduce that transmission risk. Now, when you're looking at implementing a UV program, a lot of hospitals think, well, I just want to do this in my known isolation rooms, right? I know the bugs are there. But the problem is bugs travel around within the hospital environment. They move on dirty equipment. They move on contaminated hands of healthcare workers. There was a really great study done looking at C. difficile contamination across the entire hospital environment. And what they found was, as expected, all known C. difficile isolation rooms could still find C. difficile isolated after cleaning. But in 1/3 of non-C. difficile rooms, you could still find C. difficile in the environment. So it really does move around. So hospitals really need to think about not just essentially playing a game of whack-a-mole with their isolation rooms, but thinking through, how do I deploy this strategically and systematically on entire units or entire wings of my hospital? And for purchasing managers, I mean, most of the time your hospital is not going to purchase enough devices for the whole facility. We're going to be looking at starting a program with a few devices and proving efficacy before scaling up. So just know that you're not going to usually be making a very large purchase. It's going to be targeted to specific units. So beyond reducing the transmission risk, there are other metrics that hospitals are going to use to measure the success of their UV programs. Your quality department or your infection control department is going to have several measures that they use for the quality of care associated with infection prevention. And that's going to vary from hospital to hospital because they each have unique challenges. And like what's important to a pediatric facility is very different than what might be important to an acute care facility versus a long-term care facility or a SNF, where we also see these systems implemented. Additionally, your antimicrobial stewardship program would potentially be looking at outcomes associated with these devices, because when we reduce that transmission risk, those transmission events, we can also reduce the use of antimicrobial agents that would have happened in those patients had a transmission actually occurred.
So Sarah, just going back to the last episode, I think one of the points that we made was that this isn't meant to replace the work of environmental services. Like, this is an adjunctive technology. It's supposed to run in parallel to enhance your infection prevention strategies today, right? And so I just think about those percentages of risk of transmission, just based on the only common factor is sharing a room. To me, a lot of times in healthcare, we can't get very causal in conversations, right? But when there's only one common factor, it's hard not to connect the dots pretty well. Very rarely does somebody in infection prevention have the ability to really see something that clearly.
Exactly right. So in my career as an infection preventionist, I can think of 2 cases I worked up ever when I can point to the entire chain of transmission and say A caused B, caused C, caused patients coming back in with meningitis, right? It's really rare that we have that. And for most of the infections that happen in hospitals, that's the case. We can't point to this readmission with MRSA and say that was a dirty bed rail in ICU 10, right? But we know that globally, when we enhance our environmental cleaning, whether we're doing that with changing our chemicals to address new organisms that are coming into the hospital, or we are enhancing it going from standard cleaning to microfiber, which was a big change we made about 15 years ago, or to adding UV, the reduced environmental bioburden can have an impact specifically on these environmentally implicated organisms.
Well, just looking at healthcare reimbursement and how that's changed over the last, 15, 20 years, this is where I think all the conversation we've had to this point ties to cost avoidance. And I thought Why don't we dive into that? I mean, I think everybody's kind of well aware that there is an increased cost to patients being readmitted due to a healthcare acquired infection. But I think we can tie this to, a bigger concept of cost avoidance. And so, Sarah, can you start to walk us through that too?
Sure. So when we're looking at cost avoidance, it's things like I said, reduced use of antimicrobials, right? Lower length of stay, because patients who don't pick up extra funk in the hospital get to go home a little earlier. So this means that we're able to get a new patient into that bed. And we know that under the reimbursement structure of our current healthcare system, butts and beds is how we get paid. So being able to get new patients in just lets us get that revenue cycle moving faster. Another important thing when we're looking at these technologies is letting your patients know what you are doing to help give them a cleaner environment. A lot of the companies that are in this space will have promotional or marketing materials specifically targeted to the patients in the hospital. There'll be things like banners that can be put up, or elevator door wraps, or table tents that can be left in rooms letting you know, this particular hospital system has treated your room with UV light. And we've shown that that can make a big impact on HCAHPS scores. That question, was my room cleaned? Do I have a clean and disinfected environment? And just letting patients know, hey, we zapped this space, can do a lot to improve that particular question. It's also peace of mind for patients. I mean, I am going in for surgery tomorrow for spinal procedures, right? Something pretty invasive. They're zapping my room before I go in, right? Because I want that space to be treated. When hospitals are able to advertise, hey, this is a thing we do, not just in our patient rooms, but in our procedure areas, it gives patients just more reassurance that the microbial load in that space is going to be as low as we can feasibly make it. Hospitals that are able to advertise within the community, hey, we treat not only our patient rooms, but also our procedure areas for patients who are picking and choosing where am I going to go for potentially an elective procedure. They might choose those facilities because they have more confidence in a cleaner environment.
And Justin, it's extremely important to note fine detail when it comes to cost avoidance. Generally, someone will think, if someone doesn't get an infection, then that means that it's going to be a cost avoidance to the hospital, and that's what the hospital wants. Ultimately, that's the goal. No one wants a patient to get an infection. However, there isn't a single whole room microbial reduction device out there that can legally make a claim that we are able to reduce hospital-acquired infections. That is not a claim that is available to anybody. The only claims that are available right now are to reduce the microbial load. It's microbial reduction. Why? For the following reason. It's very straightforward for us to prove that we have reduced the amount of pathogens on a specific surface. It is very difficult to prove that any work that any different piece of activity or a different activity within a hospital is able to reduce an infection. For example, was it hand hygiene? Was it antimicrobials? Was it just a general cleaning of the room? Was it the use of our robot? There are so many different things that are part of a hospital's infection reduction program that go into that. Now, one day, we hope that we'll be able to make a claim like that, because then hospitals, that's ultimately what they want to be able to do. But right now, since we are the ones that were at the forefront of this, we're also the ones that are at the forefront of saying no one's able to make that claim, and we don't make any of those claims because it is not something that's available to us right now. So we needed to make sure that we made a very, very clear distinction there. That's why we focus on a lot of those things that Dr. Simmons just mentioned that are key for a hospital to be able to show that, yes, these are the different things where we can have cost avoidance.
Yeah, I mean, I think that's the whole reason to bring in regulatory and start setting those standards, is so that you're having, conversations that are on an equal playing ground. and very clear about what you can and can't do. That's phenomenal. Let's start talking about some other considerations for sourcing. I mean, I think the two main ones we really covered is, really risk avoidance, cost avoidance. But there are other things that we need to be talking about, such as product safety. So, and I know several others. Juan, why don't you start with product safety and then we can throw out some other tips for the supply chain listeners today and as they evaluate UV technology.
Absolutely. Happy to do that. It's important whenever we're talking about something that plugs into the wall and runs off AC power for us to realize that there are a lot of standards out there that one can meet in order to prove that a product is safe. One of the things that I always encourage family members to do is before you buy something, take a look at it. What safety mark does it have? Because one can buy products out there that don't have a UL mark, an ETL mark, or an MET mark that proves that they meet some of the minimal electrical safety requirements. And what you have now is something that could be potential to failure and really, really cause a safety issue within one's home, within one's place of work, or even within a healthcare environment. So making sure that those products that are introduced into those environments, there are requirements that need to be met. So let's start with electrical safety. I alluded to this one earlier, which is meeting the IEC 60601 standard for medical devices. There are collateral standards and clauses within that standard that are in place so that public health and public safety is at the forefront, because we want to make sure that customers that buy these products have that peace of mind that if you connect that to the wall, it's going to operate in a safe manner, and not only in a safe manner for a patient, but also for the user. We need to make sure that the user safety is in mind, that under any fault conditions, we won't have a hazard in place or a hazardous situation that could ultimately lead to a harm with respect to either the patient or the user themselves. So that's one of the things that we really took pride in when developing the Light Strike Plus, is to make sure that we met the highest levels of product safety to make sure that anybody that interacted with a device was able to do so in a manner where they could have that peace of mind. So from a supply chain perspective, when someone is looking at buying some of these products, even for your own personal use beyond that, take a look at those marks. What kind of safety standards have they've been able to meet that'll give you that peace of mind when you're using it? And of course, when you put in an FDA submission, they require review of the data to these safety standards to make sure that what you are advertising is, again, like we talked about earlier, safe and effective.
Sarah, what are some other important considerations as we are kind of getting close to the end of the podcast? I just want to make sure we build this out. And I'm also going to use this as an opportunity to tease the audience that we will have a link in the description for this podcast where you can actually download a supply chain UV checklist tool. So if you're out there like making tons of notes while we're talking, we are going to give you a tool to help you kind of make sure you're checking off all the boxes in your sourcing activities.
So there are a few other things that hospitals need to think about. And one of those is that the reason we're a medical device is because we interact with other medical devices. And it's not just proving that we can reduce the bioburden on those devices. It's making sure that our product doesn't mess with the other products. So I live in sunny South Texas, and if I leave my deck chairs out all summer, they're going to crack and fade and look not so great by the end of August. That's because of exposure to UV light. And that's a concern for medical devices that are potentially exposed to UV technologies as well. We need to assure that we're not going to have degradation of plastics, of acrylics. And these are not just cosmetic changes. There are potentials for microfissures or crazings to occur on these plastics that can then become a reservoir for bacteria to stick around in. Imagine like a lake bed that dries out, that gets cracks. That's what can happen to these plastics. And bacteria can hide down in those little crevices and potentially pose a hazard because we can't effectively disinfect those products chemically any longer. Usability testing also refers to how does the product move around within the environment. All of these authorized technologies need multiple positions within a room. So how easy is it to get these devices to where they need to be within the space? And how easy is it to move them from room to room as well? And we want to make sure that we're not having something that's potentially bulky or challenging for our EVS staff to move around. And then with ease of integration and expansion, we want to make sure that the technology that we're implementing is able to tell us how good a job it's doing at the program we've set out for it. So when we specifically implement a hospital, they get a standard operating plan where they've decided this is where I'm going to use my device. This is my goal for how many rooms in a day I want to do with my devices. And then there's a portal that anyone with a login can check at any time and see in real time, what are my devices doing? What have they done over the last week, over the last month? You can run ad hoc reports to drill down into your information to make sure that you're using it the way you wanted to actually be using it. And very helpfully, it gives you user level data on who potentially may be running into issues using the device, who maybe is skipping a position when they're treating a patient room, or who may be running inappropriate cycle times. And you can be like, hey, Steve, on third shift, we need to retrain you. You gotta get with the program, my man. So that's really helpful. And the other thing is expanding. As I said before, a lot of hospitals will start with 1, 2, maybe 3 devices, and then want to expand their program. What's really helpful is having a company with a understanding of hospital epidemiology and the way that these organisms are transmitted within the healthcare space to help you expand that SOP when you go into a new area. Because the way I would handle C. difficile in a rehab unit is completely different than how I would handle, let's say, MRSA in a NICU. So just having an understanding of epidemiology with the company, because we're going to be the UV experts, but we also need to be the environmental transmission experts as well to design a program that's going to be effective.
So Juan, safety, so important, obviously, with any device. The last thing any hospital needs is, injuries for their staff. And so let's talk also about service and support and maintenance, because you can have the safety measures, but you've got to maintain the equipment so that it also continues to be safe, right?
Absolutely, Justin. I always like to illustrate it this way. You can buy the most premium or luxurious car. That dealership is still going to have a service center. Why? Well, these are things that run around roads, hit potholes, and there are mechanisms in there that wear out over time. So it could be the most expensive vehicle. There's some level of service that's needed. Well, if we think about whole room microbial reduction robots, those are also being wheeled around a hospital. They run into things. They're being used in different environments. So they're going to require some level of servicing. So whenever someone is looking at purchasing some of this equipment, they need to make sure that they clearly understand what options are available to them. Our LightStrike Plus robots are offered with the service plan so that we can make sure that that robot is always ready to run at a moment's notice. We train technicians within the hospital's systems so that they're able to do this servicing. If they require additional servicing, they can connect to our service folks who will walk them through whatever repairs need to be done. Additionally, what happens is if for some reason they can't do that servicing on site, well, they can send the robot in, then we'll do it in our shop, give them a loaner during that time, or send them another one. Why is it important to know that? Well, we need to make sure that they always have availability to be able to keep their program running. So whenever any customer is looking at a purchasing decision, that's something that they need to consider. What is this organization going to do to make sure that my devices are always ready to run and are available in case something needs to be repaired? But in addition to that, what kind of support is available as well? Our robots are also connected back to what we call our disinfection management system portal, where we're able to get information about just how well those systems are running based on how they were configured. So, for example, we could have a facility that has 10 to 20 rooms within their med-surg unit. They'll identify those rooms, and we can tell when the robot was run in each of those rooms, and then we're able to provide that data back to them just so they can see how well their program has been running. In addition to that, there's additional telemetry that we get from the system just to see what its health looks like. Is there an issue or an impending issue that needs to be addressed preemptively so that robot can continue to run? And then on top of that, we have our typical preventative maintenance so that the robots are always running in tip-top shape. But what it requires is us to be able to get that data, aggregate it, synthesize it, and then make a decision on what needs to happen for that particular device. So when a consumer is looking at making a purchase, they need to keep that in mind as well. What type of data is being made available to me so that I can see just how well my program is running and how well my device is running as well.
So as Juan mentioned before, UV companies are not allowed to make HAI reduction claims. So we don't want to use that specifically as a metric. However, every hospital out there looking at UV technology knows that the reason we're interested in implementing this tech is because it reduces the microbial burden on surfaces, and that in turn reduces the transmission risk associated with that contamination. So hospitals can think globally within their particular system about the transmission risk that we see in our current quality data. What do we think the impact of adding a technology that reduces that bioburden could be for us in our specific facility? And just think about that internally. Additionally, AMR programs, what potential could it have on your prescribing practices for patients that are not getting these transmission events? And for length of stay, that's going to be unique to each facility. There's not a particular rubric that I can give you that says, here's an Excel spreadsheet, plug your information in. That's just not going to work. This is going to be unique to every single hospital. Another thing that purchasing should think about is not just from an FDA regulatory perspective, but from a CMS and Joint Commission perspective. Those organizations don't make product recommendations specifically. So they're not out there saying, hey, you need to buy this particular thing, but they are encouraging the use of technologies for enhanced cleaning within the environment. And we have specifically seen them doing a check within their surveys for if your hospital has elected to use an enhanced cleaning technology, are you using one that is FDA authorized? Because they have a concern about patient and staff safety associated with these technologies. So if you're going to have Joint Commission coming in soon, you want to make sure that you've got an FDA authorized product, right? So that you're not going to potentially have a ding on your survey for your environment of care rounds. Finally, FDA authorization has been key to simplifying the life of purchasing groups, because before you would have had all these individual items that you needed to look at for UV technologies that are already included under the umbrella of what FDA looks at. It is all taken care of for you. So does it work? Yes. Is it safe? Yes. Is it compatible with materials I have within my healthcare environment? Yes. And so now you're down to how does it fit within my workflow, right? How much time is it going to take me to potentially treat rooms with these technologies? How many rooms per day can I do with these different technologies? What is the baseline cost of these technologies? That's where our decision making needs to happen, which really makes the selection world a lot smaller for our purchasing groups. There's just less that they have to consider. And like you said, there's going to be a checklist provided afterwards. There are still some things that you need to think about, and we're trying to make that easier for the purchasing teams that are out there so they don't have to, invent this out of whole cloth, right? They have some tools that are already available.
Yeah, and hopefully they'll be able to share that out with their internal teams as well, because not just what does purchasing need to know, but anybody who might be getting contacted, by companies that are definitely saying UV has the ability to, improve or enhance your infection prevention. If you're not doing it today, I think just helping everybody ask the right questions as they may be getting contacted. So not just a tool for purchasing, but for purchasing to share, I think, within the organization as well. And maybe even inform around FDA regulation, because maybe not everybody is aware of that. So Sarah and Juan, really want to thank you so much for coming on. This is the second. There is another episode coming. If you didn't listen to the first one, I'm going to point you back in that direction as well, because the series is a wonderful series, and it's the only one that has continuing education credit approval specifically focused for supply chain professionals and UV technology. So once again, Juan, thanks so much for coming on the show.
Thank you, Justin.
And Sarah, once again, thank you as well.
You're very welcome.
That was Juan Gonzalez, VP of Engineering, Quality, and Regulatory Affairs, along with Dr. Sarah Simmons, Science Director at Xenex. And today we really talked about that regulatory landscape for UV robots. And Juan was able to go a lot deeper into the reasoning behind that and some of the important considerations, especially around claims that you're able to make in terms of the effectiveness of UV technology, specifically UV robots. So I really enjoyed the conversation today. And as Sarah mentioned, there's a lot of important considerations for sourcing, not just around risk avoidance and cost avoidance, but usability testing, compatibility. And there's a checklist that you'll be able to download. It'll either be available on our smartphone app as bonus content, or you can click the link in the description for this podcast episode. So thanks again to Juan and Dr. Sarah Simmons for joining me today. And don't forget to stay tuned for the third and final episode coming up. So on behalf of everybody here at Power Supply, thanks for listening to this episode.